Now is Professor Andrew Menzies-Gow. He's consultant in respiratory medicine at the Royal Brompton Hospital in London, and he has a particular interest in patients with severe asthma and specialises in eosinophilic lung disease. Professor, it's very good of you to join me. Thank you very much indeed.
Thank you. My pleasure to be here.
So let's start right at the very beginning. Perhaps you could tell us why it's important to prevent exacerbations of asthma.
I think historically we've sometimes underestimated the importance of asthma exacerbations. So they're important for two reasons. Obviously, there could be different severities to the asthma exacerbations, from mild exacerbations that respond very quickly to therapy to very severe exacerbations that sadly can be either near fatal or even fatal. And we've seen that with the National Review of Asthma Deaths published in the UK. So I think asthma exacerbations are key for two reasons. They must be treated appropriately and promptly, but they also should serve as a red flag for those of us that are healthcare professionals looking after people with asthma. So whenever someone has an exacerbation, we should be looking at inhaler technique. We should be looking at the fact they've got a peak flow meter so they can monitor their disease properly themselves. And we should be empowering people by providing them with a personalised asthma action plan so that they can manage the asthma as well as they possibly can to prevent future exacerbations. Because we know the biggest predictor of a future exacerbation is a history of previous exacerbations. But so for those two reasons, given the severity of a potential exacerbation and also the fact that it predicts future exacerbations, are two reasons we should be taking them very seriously.
That's really interesting. I've just been talking to William Bussey about the fact that we're living in very strange times, and obviously COVID has changed sort of the way that diseases manifest, and mask wearing, social distancing, washing hands has had a profound impact on asthma. And clearly, as those measures are lifted, are you expecting to see far more exacerbations of asthma coming forward?
We know that many exacerbations of asthma are driven by viruses. And we've seen over the last 18 months with the COVID pandemic that by social distancing and other measures, people have had less asthma exacerbations. But clearly, as life starts to go back to normal, we are expecting non-COVID viruses to start to circulate more widely in the population and people to start to have more viral exacerbations than they have done previously.
So just in theory, is prevention of asthma exacerbations achievable? You talk very much about making sure the patient's empowered, making sure they're monitoring their own conditioning, taking their own medicines as they should do. But can you really fully prevent exacerbations?
So it's certainly the aim, and that's what we should be aiming for all the people that we're looking after. For some people we can, simply by good inhaled medication with good inhaler technique. For people with severe asthma that I look after, that isn't necessarily enough to control their asthma, but we can, with biologic therapies, have a transformative effect for some people, but not all. And certainly many of us looking after people with severe asthma, when we put them on a monoclonal antibody that may be targeting eosinophils, maybe targeting IG or something else, and we'll see someone who's a super responder. And in that individual, they stop having asthma exacerbations at all. So that's what we should be aiming for, and we can achieve it for some, but not for all. But anecdotally, if I see one of my patients and I put them on a biologic, if I know they're doing well, if they say to me, well, I had a cold, but it didn't go to my chest and my asthma didn't exacerbate. So in other words, they're still getting exposed to those viruses that they were before, but because of the new medication we've started, that prevents asthma exacerbations. And certainly zero asthma exacerbations is what we should be aiming for everyone with asthma. It's not currently achievable, but as we continue to develop new therapies, it will be for many more patients.
Yeah, I mean, obviously the advent of biologicals is game-changing. I mean, since I was at medical school, the whole field has changed dramatically. Are you hopeful that as we see new medications coming online, that we can finally get asthma patients into a full state of remission?
Yeah, I'm very hopeful. And I think that's why we started to talk about remission. So within respiratory medicine, within asthma, we've always aimed for asthma control. So well-controlled asthma is likely to lead to less asthma exacerbations, which is a great thing to do and is exactly what we should have done. But now we have up to 5 available biologics at the moment with more in development. We need to really be changing the paradigm and aiming for more. Myself and Bill and others have published some work around trying to define what asthma remission actually means. And to do that, we've looked at colleagues within other chronic inflammatory diseases, such as rheumatoid arthritis or inflammatory bowel disease, where they've had biologics for a bit longer. And they've really moved away from control towards defining remission. So I think it's a really important next step for us to start to define asthma remission. And we can define that both on clinical grounds, on terms of biomarkers and airways inflammation. And we can look at clinical remission, complete remission, both on and off background therapy.
And of course, availability of these medicines will be really important. Here in the UK, as you say, there are 5 biologics. In other countries, there are fewer. Do you think, and obviously cost comes into this, do you think we'll see a state where biologics are freely available around the world?
Yeah, well, clearly new drugs development can be expensive, and biologics, by definition, because of the way they're developed, are more expensive than inhaled therapies. And I think actually as clinicians, we haven't done the best job describing the significant impact and benefit of biologics, particularly when we compare it against oral steroids. So the majority of our patients will be taking inhaled steroids, but people with poorly controlled asthma and severe asthma will be taking oral corticosteroids. And although they are cheap at the time of prescription, there's a significant cost associated with them in terms of morbidity and long-term consequences, for instance, diabetes, high blood pressure, cataracts, osteoporosis, increased risk of infection, increased risk of peptic ulcer disease. I could go on and on. So I think it's really us in the healthcare community describing the clinical and the cost effectiveness of biologics, which will allow them to be prescribed more widely.
And given this programme is watched by clinicians around the world, what's your take-home message for all of them?
I think the most important thing with everyone with asthma is always strive to do better. And we know that our patients with asthma will often put up with a lot of daily symptoms and almost expect to exacerbate. And we should really be moving towards a scenario where, wherever possible, we're making sure that our patients don't exacerbate. And if they do exacerbate, we're looking for triggers. We're looking to optimize therapy, and where available, we're thinking about whether or not a biologic would be the right choice for them.
Well, that's fantastic. Thank you very much indeed for your time, Professor Menzies-Gow.
Thank you.
Well, that's it for this edition of EUFOREA TV Breaking News. Many thanks to my guests, to Professor William Bussey and Professor Menzies-Gow for their insights into the all-important prevention of asthma exacerbations. And in October of 2021, EUFOREA is organising an asthma prevention workshop in Berlin, and we'd love you to join us. Now, you can find more information about this workshop and register to attend on the euphorea.eu website, where you can also sign up to receive the latest news via email. You can also follow us on Twitter. The address for that is @EUFOREA. But that's it for this show. See you soon, and thank you for watching.